St. Henry's Kitovu, where are you? Come on, let us clap for them as they come.
My name is KAWA, and I stand as human resources. I'm currently offering BCM, stock ICT, and senior 5.
My name is Emmanuel, from 5 offering PMTD, stock ICT, and I'm the project manager.
My name is Nala Xavier. I'm in senior 3 and I'm the managing director.
My name is Arena Andrew. I offer BCM stroke ICT. I'm in Form 5. I am the CEO of this company. We are students at St. Henry's College. So what's the first thing you thank God for when you wake up in the morning? It's good health, right? That is to say, you're not always certain of the health you're going to have at the end of the day anyways. So that puts us in an urgent situation to give you a very good solution. Let's first delve more into what the health sector within Uganda looks like. One, that doctor to patient ratio within Uganda is 1 to 1,000. That is to say, one doctor works on 1,000 people within a particular hospital. When you go to rural areas, it may be a village, you find that a doctor works on more than 1,000 people. That directly implies that pregnant mothers are going to constantly make long lines when they are in hospitals to get medical attention. Two, the government is also an important stakeholder when it comes to using taxpayers' money, because very many people pay taxes and this money has to be used effectively. There is no proper mechanism to always track the way doctors are operating within the medical system. That becomes much more of a problem as doctors constantly don't work at hospitals but still get salaries at the end of the day. So I think government has to find a way to always track these doctors at the end of the day. The third one goes more to patients and also doctors. When you go to a hospital, you always have to put your medical records in order to get maybe proper medical attention. The reason that is important is because doctors then get to know how to prescribe you or without maybe making a lot of errors. I think within status quo right now, people do not keep their records. Even doctors in hospitals, mostly within the country, because we are looking at the whole country in general, local village health centers do not keep patients' records, and that becomes much more of a problem. There's limited appointment availability. That is to say, people do not easily get doctors at the right time and at the right place. It is then very hard for them to get relevant medical attention in the right time, because health is not a spare tire. Health is not something that is supposed to be kept maybe constant. You have to act immediately. More so, first aid information has become a very big gap within society. When someone reaches an emergency situation, it is then very hard for them to get first aid information very fast at their fingertips. If at all they maybe call their doctor and their phone numbers were off, it becomes very hard for them to get medical at that particular moment, and that is also a very devastating problem. Lastly, it comes in with issues concerning overdose, more so onto people doing self-medication. That is also a problem because people always become complacent, because there is this whole doctrine that when you get headache you always have to take maybe paracetamol, and that becomes more of a problem. With my team, we thought of that and took it as a very urgent matter, giving us a basic necessity to come up with an urgency solution.
Introducing Smart Care. Are you ready to turn every chance into a life-saving opportunity? Smart Care is a system for optimizing all healthcare and hospital management systems. Not a website, a management system to be used in every hospital. We looked at our objectives. One, it's on patient tracking and also looking at all their records. It's that Smart Care has a system that you can follow up all patients that are in your system, their prescriptions and all of that. Secondly, it's on the idea of reducing time wasting at hospitals. Lots exclusive tells you how hospitals, people have to make long lines and all of that. Difference with Smart Care is that you now book an appointment early, and by the time you reach the hospital, the doctor is already expecting you, which is way more efficient. Thirdly, it's on the idea of digitalizing patients' records. It's that patients don't really keep their records, but even for follow-up, doctors find it very hard to always use the manual records. Difference in smart care is that all these records are kept digitally and they can always be accessed. So which means you can always have each patient's records anytime they need them. The solution that smart care offers, one, is that we have a feature for doctor appointment and booking. i.e., you can always book a doctor through our system, and by the time you go to the hospital, you can always talk to this doctor without necessarily having to make a long line because the doctor is always expecting you. Secondly, it's online prescriptions. We have a system that the doctor can now prescribe you medicine online. They can now give you a prescription without necessarily having to move to the hospital, which is way time saving, but it also improves the accessibility in the country. Thirdly, Smart Care gives you a step-by-step first aid module on how to give first aid in many situations, saving very many lives in many communities. It's on the idea of doctor tracking. Smart Care gives the super admin all power to see that doctors who are working on that day, the doctors available, so we don't really have doctors who are getting free money because they don't really show up at the hospital. We monitor all of them. Lastly, it's our medical assistant. We have a feature that gives you, it's like your personal doctor, that gives you information about any situation as long as it's concerning health and emergency. Let's look at the system.
As the CEO of this company, I believe more into showing you what the actual system looks like. One, on our user interface, you could be able to access this on a dashboard. But then imagine you are in an emergency situation and you maybe had a problem with maybe something you would like to get immediate action or immediate knowledge about your health. We use deep learning to come up with an assistant that could help you with most of these things. This is very important as it gives you correct information. Here's why. I do biology, he does biology. We had probably used credible sources to give you this information. It's going to be right? More so, after looking at this, maybe you're already a patient and you want to look more into other things that are more important. You could go on to, maybe you want to meet a doctor, right? So you could go on to booking an appointment, you first log in as a patient. As you can see, on your UI, you could be able to probably see the doctors or maybe the appointments you're going to have in the nearby future. After looking at this, maybe you wanted to book an appointment with a doctor, you want to cut the line instead of going to a hospital. So you could see all the doctors available, the specializations of these doctors, we have many in plenty. After looking at this, you see the prices and their locations, if at all you could afford those things. And then you look, the second step is to look for the date and time that is maybe probably enough or good for you. And then after choosing that, you go on to our last step where you have to fill in your user information to make this mostly relevant for the doctor. You choose a payment option that is relevant or good for you, agree terms and conditions, and yeah, you book an appointment and pay. After that, you have to go and look at your appointments and maybe see if at all the doctor prescribed for you and see whether or not it's relevant.
On the doctor interface, when I log in as a doctor, my dashboard looks something like this. One, I can monitor my efficiency. You can see it marked in green. I can always monitor my efficiency to see how good I've been working. The appointments I've worked on, the prescriptions I've given. On the left are the recent ones, on the right are the appointments. Then I also have to follow up on my appointments. Let's go to the side of appointments. I can follow up on my appointments. Now, Lord's booked an appointment, and here the appointment has come, and I now have to approve this appointment with the reason I am available. If I'm not available, I say no, and this patient is directed to another doctor. Then, after approving the appointment and I've met the patient or I've talked to this patient, I now go ahead to prescribe medicine. The prescription comes from a doctor. We don't have self-medication like what we told in our problems. I'll give this patient all the information he needs about it, and it will be so important because the prescription fully comes from a doctor and I create it, and the patient will get it in his side. Then lastly, it's on my profile. Things with data security is that I'm advised to always change my password once in a while, which is very important to keep like my account safe. So my profile gives me the option to always change that once in a while, making it very efficient in that regard.
So dear judges, he prescribed for me, so I'm a patient waiting for prescription at home. So I can come and view my prescriptions. After viewing it, maybe I have a nearby drug shop where I can go and buy the medicine that has been maybe recommended for me and see the time in which I'm supposed to take it, see the doctor specification. I could even get their phone number, that is to say I could call them at the time of my convenience. Yeah.
The third and last most important user is the super admin. When you look at my dashboard, I'm able to run the system, monitor it, and probably ensure that it's working efficiently through preventing things like overload. To begin with, I'm able to see the total appointments that are running in the system, but then extensively I'm able to see the total prescriptions that are running in the system, and then I'm also able to see how many doctors do I have in the system. Are these doctors able to serve smart care? Looking at my left, I'm able to see the recent appointments. This is so important so that I'm able to monitor how the appointments have been treated. Are most being confirmed? Are most being cancelled? Is smart care being efficient? But then most importantly, these keep as records so as to enable smart care being efficient. But then on the right, you're able to see that I'm able to keep track of the doctors, how they are working, who is working best, how many appointments are they working upon, and this is so important to me as a super admin. Extensively, my most important tool is the user management part. At the user management part, I'm able to see all the users in the system. I'm able to see their information. I'm able to go and view their information, their names, their contacts, and where they are from, and probably be in position to determine whether they stand as a threat to the system. And once they stand as a threat to the system, it is so simple. I will delete them out of my system because I want smart care to serve its purpose. Down to the tool I use to monitor my doctors. That at this tool, I'm able to see all the doctors that are in my system, their contacts, their years of experience, and then most importantly, that at the point where some doctors are facing challenges, I'm able to deem them inactive so that patients out there do not have appointments with them because they will be clear, it shall be clear that these doctors are not active. But then most importantly, as super admin, it's only me in charge of adding new doctors to the system. Then I will click there and probably adding the information of this doctor I want to add in, and in a matter of clicking, create a new doctor, and boom, I have a new doctor to probably serve new sectors in the health sector. But then looking more about the patients, here I'm able to see all the patients in the system, their information, where they are from, and all this, and at the point where they stand to be a risk, I'm able to delete them out. I'm also able to view all their information. This is so important to me. But then most importantly, once this system is like at a hospital, I'm able to also add the patient while I'm at the hospital and probably add them to the system. But then I'm also able to look at my profile. I'm able to look at my profile and time after time change my password so as to make sure that smart care is offering the best security for all the information that runs in it. But then being super admin doesn't change the fact that I'm human. That once I'm sick, I can also have an appointment for myself, choose a doctor, and follow the procedure just like any other patient would. But then later on, I can also view my prescription. Ladies and gentlemen, smart care is not just an idea, it's not just a concept, but then this is a practical solution to the problems we are facing. It's a practical step forward into creating a better eco-health system. I call upon you all in your different and unique roles to come join us, collaborate, and let's make smart care more efficient, more smarter, and to serve and to offer us the best health ecosystem. Smart care where efficiency meets health will remain. Thank you very much.
Thank you so much. We have heard from the environmentalists, we have heard from the doctors, we heard from the electoral commission. That's the good bit of everything when you invite students to showcase. So I'm going to give, you're the ones to decide now because these people are going to sit between your lunch. So if we allow you, ask so many questions like that. Let me give ready.
Thank you for your good presentation. I have like two questions. One, like if someone is staying in Gulu and they don't live in Kampala, right? Then it's 5 to 6 minutes from Kampala to Gulu. So if a person is in an urgent condition, can really that person not die because it takes time to reach to the patient?
What's the alternative existed? What alternative exists right now?
I think maybe.
So you can see that our alternative is better as we have a medical assistant that could help in an emergency situation. I think it's better than the alternative of walking or driving long distances the thousands of kilometers that are in Gulu to the nearby health center that doesn't even have effective services. Thank you.
And also another question, like especially poor in the village, and most of them they can't afford maybe booking their doctors, right? So how will they manage to use your app?
Yeah, sure, thank you. So for purposes of affordability, we have a variety of doctors, right? As you could see, we have a variety of doctors at different prices, so you could access the doctors you can afford. If you go to the shop, you don't buy everything, you buy the stuff you afford.
Thank you. Yes, she has got a good answer. So now I just want to, this gentleman asked me a question. I want to give someone else a chance. This person.
Thank you so much. I just want to build on her question that she asked. We talked about emergency, and we know, though you may prescribe a drug, somebody might be in critical condition where that person needs surgery. Do you have an alternative for that surgery before that person takes a prescription that he can get anywhere?
So I think if you are keenly listening to my speech, we told you that you book an appointment with a doctor, right? That is to say, instead of going to a hospital to make a very long line, you book an appointment with a doctor at that specific time you want. But then more so, if at all it's an emergency, what would you do if you were in an emergency situation? For example, in Gulu, right now, with this system not in place, and then I show you how our alternative is better. You can give him the microphone.
Oh, as someone from, I guess someone gave a scenario of Gulu. So they were supposed to defend you. So
I think because someone when he or she is in an urgent condition, basically they take them to hospitals, and also know that people who are in such
How
conditions,
do they take them to hospitals?
basically those who are near them, they can take them to a nearby hospital, right?
So you can go to a nearby hospital
Yes.
that's registered with our app very fast without needing to make a line when you get there.
But according to me, your app, right, will take time. Like if the doctor is in Kampala, he or she will travel up to Gulu, taking 6 hours. But if a nearby hospital, at least can take a good medication before the doctor arrives.
So the perception here is that you want someone that can teleport. The system helps you access a doctor easily. The whole point of smart care is for me to go to the hospital and the doctor is already expecting me. So it means the doctor is already prepared for that emergency situation. But if you claim that there are things that need traveling, we have a medical assistant that provides you with information that can help you in the meantime as you actually meet that doctor. The alternative you have is that you walk up to that hospital, you sit in that long line with 100 mothers waiting for the same doctor, and you still wait for that surgery. When you look at the two things, ours makes it just faster and safer. Thank you.
To add on to our response, I think you were able to see what we were showing there. That when you're making an appointment, you can clearly indicate the type of appointment you are making. If it is an emergency, I want us to look there. If it is an emergency, it's a matter of indicating that this is an emergency, and the doctor shall be able to treat it as an emergency, and your appointment shall be treated with the best it can be.
Thank you, dear presenters. I'm a student of PM/ICT. You have stated it clearly that the ratio of patients to doctors is 1,000 to 1. So what mechanism are you going to put there such that the doctors that are attending to these 1,000 people, one doctor attending 1,000 people, what mechanism are you going to create that will cause that doctor to divert from the 1,000 people he she is serving to come to your online platform to serve them?
I think that's a really great question, but then there's something you're failing to get here. The ratio of doctors to patients is 1 to 1,000 in Uganda today, making people make long lines when they go to the hospital, right? But then, it is worse when you're going to a hospital without the doctor expecting you. The alternative we give you is that at a point in time where you go to meet a doctor, the doctor is available and they expect you, so you don't have to waste your time going there. You understand?
Add on to that response, I get you. You talk about the ratios of the patients, of the doctor to the patients. There are two tools that you ignore. Is that the medical assistant. It greatly helps in preventing having minor injuries, minor aches and illnesses, to to the hospital. Then with the medical assistant, you are already helped. But then the second tool you ignore is about the first aid that comes with this. This is something that will probably reduce the number of people going to hospital.
Did you have the part for recommending for you medicine so that you go to a nearby drug shop and buy it? I think it really saves time online when you're not in an emergency.
Thank you very much. I had two, but now there are three questions. What you've been answering. Okay, is this system designed for a specific type of medical facility? Is it a hospital, clinic, pharmacy, or is it supposed to be for public hospitals or private ones?
So when I was starting, Azam talked about the solution, and I clearly told you, it's not a website, it's a hospital management system. Him as a super admin, he has power for like our system because we want to answer him. So we give power to a hospital admin, and they can always work on their people. You always have information of your hospital. The difference is that you keep data of your hospital, so you can always keep track of your patients. To communicate with other hospitals, we have online records. So when you transfer to another hospital, you still have the documents to just show to another doctor for easy follow-up, not current status quo, where someone from, let me say, in the village of Kangulumira has to walk to, like, let me say, Kampala without documents and just ends up suffering because they lack things like follow-up. Is it answered?
I think I'll appreciate for the answer.
Thank you.
Come on! A round of applause. You guys, hospital management system. Such an amazing presentation. Thank you so much. Who are still having questions, please reach out to them, okay? Ask them whatever you want. And thank you so much for such an amazing presentation. At this juncture, we are going into what we call swallowship. Everybody say? Yes, we are going to swallow something, yeah? But before we do that, yeah, maybe as we get there, I want us to know each other, okay? I know different schools have been here, okay? Take this moment, get to know one another, get to know, okay, each other.